Hello, let's see how we capture the COC and other details in Crelio's app. So, this is the app. This is the landing page. Now, once Phlebotomist/CT logs in, he can have a calendar view in which he can select which duration he or she wants to view visits for. By default, it's always set to this month. Next, moving on, as you can see here, if it's an ongoing collection, the rows are marked in blue. Similarly, if it's a collection due for today, it's marked in green. If a collection is due for future is tomorrow and onwards, it's marked in yellow. And if the collection is overdue, which means that time is gone and collection has not happened or begun, it will be marked in red. So, let's start with the booking that we have booked in our previous video. This is the booking page. As you can see, I can see the actual donor count, booked donor count, all the information related to the order, which is the job ID, job type, reason for test that we added, time of collection that we have selected April 18th, 10 a.m., site contact name that we had entered, phone number of site contact name, and comment. We can even go and have a map view of the address for the phlebotomist to travel to the location of the site. This will open the Google Maps of the location. Now, to start with a visit, left base is the first status, which means that the phlebotomist has left from his or her house or from the previous location to go to the location of this visit. And next, on site, is when the phlebotomist has reached the location. Moving ahead, collection started is the status marked when phlebotomist has reached the location, and we'll be now starting with the collection after checking that everything is properly available and donors/patients are ready for the collection. Only after the collection started is marked, that's when all of these fields are editable and actionable. So I can now edit tests. If the test added while booking is not correct and needs to change, I can remove the test and add the relevant test. In this case, I have removed the previous test and added urine drug test collection procedure. This will now be applicable to all the patients/donors in the order. I need to always add a reason for change. If I do not add a reason for change and get the change authorized by the site contact, this change won't be saved. So, let's add a dummy reason for change since it is mandatory to be added for us to proceed. The site contact, who is the POC from the client, has to authorize this change that yes, we had requested some other test, but now we want to do this test. As a proof of authorization, we take the site contact's signature and save it. This makes the change compliant, and the lab has a proof of change to be shown if required in future. Similarly, for the donor list, the booking had 5 donors, which we can see here. When phlebotomists get on site and realizes that actually there are more or less donors than the booked count, I can remove the donors from here or even add more to the existing count. In this instance, we have removed 3 and added 2 donors for demonstration. Now, again, since this is a change from the booking that was requested versus what is required on the site, we need to have a reason for change, followed by the authorization of the site contact. Site contact needs to add his/her signature. This ways, the app ensures that the client is informed about every change that happens, avoiding any future legal troubles. Moving ahead, let's begin with the COC of the first donor. As you can see, this Mehul site name has been pre-filled. This is the same name we have as the site contact name in booking details. This is the capability of the form that, if there's a question in the form and we have relevant details in the booking, we can fetch those details from the booking and pre-fill in the form so that additional efforts are not required to be taken, and this way we also minimize any errors. Let's complete other questions in the form. Any issues with site for the future, I will mark it as no. Add CT's signature. CT is the collection technician, also known as the phlebotomist. Confirm donor ID. Say its driving license. All of the important things are done. This is the part where we register the donor by providing all the necessary details, which is the donor's first name, donor's last name, and donor's date of birth. Let's say name is Mehul 1. Here, on date of birth, we have a validation. I cannot pick dates which are in the future. Let's pick April 1st, 2025, and move ahead with donor registration. This is where we confirm the test that is being performed on the donor. Any changes that we do here will be applicable for this particular donor only, and not the entire order, versus the changes that we did earlier by adding reason for change were at the order level, and those changes are applied to every donor in the order. For now, I am not making any change for this patient. Let's confirm and proceed. Let's finish the required COC questions on this page. The form supports all kinds of question types, as you can see here: drop-down, text input, large text, and many more, which we'll see in the form as we proceed. This is the network rail question. I shall mark it as no and proceed to the next page. The form also supports confirmation messages. I mark it as confirm. Now, we did the donor's check-in, donor registration, confirming the test for that donor, answered all check-in questions, that donor checked his or her ID, make sure that the site or the collection area is clean, etc. On this page, we confirm reason for test, confirm the test again, and this is where we take final consent from the donor. This is usually what we term as the startup process. This is a common process, and this will have to be captured for every donor separately, irrespective of whatever tests have been added. Let's proceed. This is the COC for urine test collection procedure. We had added and confirmed this test. So this is where the actually test-related questions start coming up. So I will start completing it. We have supportive camera, so that questions which require to have photos captured are possible. The camera component also has the capability of scanning the barcode in cases where we need to scan barcode of the kit or any offline form. This is a question where I can have different conditions on options. In this case, yes or no. If I select yes, there is a different route to the form. If I say no, it will take me back to the question where we select a new kit again. Let's say I select no. The form will ask me to confirm this. Are you sure sample is not sufficient and you wish to restart? If I confirm and proceed, this is where the form will restart. If I select yes, I go to the next question in the COC. Again, similarly for question where we confirm that the sample is not adulterated, the collector inspects specimen and sees if it is adulterated. If it is adulterated, again the process will restart, the form will restart. As you can see, it has gone back to the specimen collection page, which instructs the CT to collect sample again, since the previous was adulterated. So the CT completes the sample collection again and marks the necessary things as complete. Again, we can see the sufficient sample question. For demonstration, I will select it as no, and again we are back at the sample collection page, which means again a new sample has to be collected since the old one was insufficient. Now, to proceed, I will mark these as yes and no. Please note, this was the third sample that was collected and was not adulterated nor insufficient and met the criteria, and now we are completing other COC details in the form. And finally, we move to the close-down process. Similar to the startup process, a close-down process will always appear after all the COCs of selected tests have been completed. This is a common procedure that will happen for every patient, again, irrespective of whatever tests we select. So, I'll complete the close-down process. In the close-on process, I can see the entire extensive summary of what questions have been answered. All the loops that we had with sample insufficient and adulterated has also been captured for all instances. So, after the summary has been reviewed by the CT and the donor, they both add their signatures to attest that the COC has been answered and marked correctly. Once we complete with the signatures, this is where we complete the COC for one donor. So this is where I can see that the COC has been completed for the donor. And we have 3 more donors for which the COC is pending. Now, in this case where we have a pending donor, the CT cannot complete the collection, since technically the collection is not complete for all donors. The CT can choose to go ahead and complete COC or remove the pending donors in order to complete his or her visit. Again, since we are removing donors, we need to be compliant and hence need to enter the reason for change and get this change authorized by the site contact person. Let's check some other capabilities of the COC form. We can add notes and even abort procedures for a donor. So if I want to add notes, like donor acting fishy, for example, I can add a note, and these notes will be stored throughout the collection. If I go to add notes again, I can see previously added notes, and even add new ones. If I add a new one, say the donor is sweating, this will be saved along with the previously added notes, and can be viewed again. The CT can keep on adding any observations that the he or she has or anything that they feel is noteworthy. All the notes will be also synced along with the COC and details to the web, and a notes PDF is generated separately for the lab to refer to in the future. Coming to abort process, Abort scenarios are rare when the sample is constantly being insufficient or adulterated and there is nothing more the CT can do, or we started COC of a donor and then donor refrained from some of the consent or some of the procedures that are supposed to be performed, or the donor was not comfortable. In all such scenarios, a formal abort process can be initiated by the CT, in which we have a few questions. We inform the site contact of early termination. Has the donor refused or withdrawn consent? If the donor has refused or withdrawn, he can take yes or no, whichever. And reason for refusal, say we add donor, not comfortable, followed by the site contact's signature. Then, that's when the procedure for the donor 2 is aborted. Donor 1 has been completed. This is the scenario in which even if donor 2 is aborted, it's kind of a completed scenario for this order, and this is where we proceed with completing the collection. Are you sure you want to complete? Yes. Now CT is ready to leave the site, and we'll mark the leaving site status. This is when the CT leaves the site and travels to the base location. Return to base is where the collection technician has completed all the procedures, left the site, came back to the base location. In the end, the CT needs to add his mileage information. There are 2 options. The CT can add mileage or can add mileage reason, and then additionally we also calculate mileage on the web tracking as well, based on how much the CT has traveled. Once the mileage information is filled, we then complete the collection and all the data of COC, status, CT distance, reason for change, every activity on app is then synced with the web and the COC and other PDFs and files are generated and are ready to use.